What's up, everybody? It's Dr. Jeff from Rythmia Life Advancement Center. So today we're going to talk about the long-term effects of trauma. So, I've been working in trauma with patients for many, many years, a couple decades. And trauma is a really tough sort of thing to kind of get past in a traditional sort of Western model, because it involves a lot of therapy. It involves oftentimes medication, depending on what the person is going through. And it involves group therapy and just a lot of time, and a lot of money, and just a lot of like stress. And it's really hard. So what I want to talk about are a couple different ways to approach trauma therapy, and also to approach plant medicine as a tool. But also I want to talk about like what happens if you have long-term effects of trauma. Like, where does that stem from, and what does that look like? So, most people that have, let's say, there's different types of trauma. A trauma that's very common for people is childhood trauma. And that can be abandonment, neglect, abuse, victimization, a bunch of different things, fear, a lot of events that are scary, all this kind of stuff. So what happens when a kid has a traumatic environment and they're going through an abusive sort of experiences, and they're in their 5, 6, 7 years old, a child will push away the emotions that would be present then, and they push them into a part of the brain called the amygdala. And that's where we store our subconscious emotions and memories and things like that, because they just get in the way for our survival in those moments. And so what I would rather do if I'm being victimized, I'd rather survive that event than freeze up and be destroyed, is what a child thinks in those moments. So I don't want that to happen. I want to be able to survive. So the way to survive a traumatic moment is to push all those emotions out of the way and just behaviorally act. And that's the way you can kind of get through it. It's like it's a fight or flight mechanism. It's something that's instinctive to human beings. So then what happens is life goes on, and I'm no longer in a sort of abusive environment. And now I'm older. And what's happening is the amygdala is probably stored up over the years lots of traumatic emotions. And if it was abuse that was occurring that caused these traumatic emotions, then what happens is those emotions start to leak into the prefrontal cortex, which is our conscious rational self. And what happens there is that I start to be influenced sort of by my emotional past. So an example of that would be, okay, so if I want to engage in a healthy relationship, I often don't know what that looks like, because I don't have that as a history. And I also have a lot of self-doubt, because when I was being abused as a child, it made no sense to me. Like, well, why is this happening? I must be a bad kid. There must be something wrong with me. I must not be worth loving, or this might be love anyway. And that I just am interpreting it a different way. So there's all these confusing things that a kid, goes through when they're 5, 6, 7 years old, when they're being abused. And then now they're adults, and they don't trust people. They feel they don't want to ever be vulnerable. Being vulnerable is like the worst possible scenario. So they're guarded. I like to call it the Heisman, like the Heisman Trophy from football and college football. You hold your emotions close, but you're pushing people away. So a lot of people get into this sort of mode where they're not engaging in a real connected way with anyone. And it's just more and more isolating. So the way you can work on this without plant medicine, just in a normal therapeutic way, is you have to have, let's say, a therapist. You have to trust this therapist. You have to work with this therapist very closely for many years. I had a patient one time but basically after about 3 years, this patient started to slowly open up, and because they finally trusted me. So we had to do 3 years of therapy, kind of just surface stuff, to actually help this patient really feel grounded enough to go deep into the trauma history. So that's a really long time, very expensive, very time consuming. That 3-year period was very high risk. There was substance abuse. There was all kinds of potential for further abuse in other relationships that they were in. So it's a very high risk time. So it's much better, in my opinion, to get the trauma just resolved. Now, how can you do that? Are there ways to do that other than therapy? Yeah, there are. There's all kinds of holistic things that people can do. There's all kinds of, there's Reiki, there's meditation, there's self-evaluation, there's spiritual mind treatments. There's a million ways. And the ways that we use at Rythmia, there's plant medicine. That's another way. And the beauty of plant medicine for trauma is that it opens up the amygdala and it connects it to the prefrontal cortex, and these emotions come out right away. and they're processed immediately. And so in 1 or 2 nights, a person can go through 10 or 20 years of trauma work very quickly. Now, what does this look like to a person that's at Rythmia doing this? Well, it has kind of a mixed bag. Number one, it's extremely liberating and it's freeing, and the person feels amazing because they've just let go of all this tension and all this pain and all this sorrow and regret and guilt and all this crap that happened when they were being traumatized. It's gone. Now, the other part is it can be a little scary because now that they don't have this sort of subconscious influence in their life, now they feel really plugged into themselves and grounded and connected, but they don't often know who they really are. So that's very important to have an integration component that happens the next day after a plant medicine session or after a meditation session or after all the modalities that we use here to help people in trauma. And if you go off into these other places, which can be wonderful too, other plant medicine locations, which are, a lot of them are great, there doesn't tend to be as much of an integration component to help give context and awareness to like what just happened. So the key, in my opinion, to trauma therapy is to feel safe, to feel trust, and to let yourself be vulnerable in a healthy way that's appropriate, and then allow the amygdala to open up and connect with your prefrontal cortex and let this stuff flow out. And the quickest way to do that is with plant medicine that I've seen. And like I said, I've been working in trauma therapy about 28 years in Los Angeles in different ways, different facets of my career. And it was always a very long, drawn out process. And a lot of people just didn't even bother doing it. Now, for people that have addiction, there's often a lot of trauma there. And the addiction model is interesting because the 12-step model, which is a layman's model, which is great because people can, you don't need to have, you just go to a meeting anywhere. It's great for some people. But because it's a lay run community, there aren't the experts there, nor should there be, by the way, but they're not there to kind of help contain this traumatic process. So the AA model or the 12-step model doesn't even go there, which they shouldn't. And I think that's the right approach. They shouldn't, because it's just, you got to stay a little bit more surface because you're not dealing with like therapeutic deep stuff all the time. Now, do the 12 steps bring up therapeutic deep? Of course they do. That's why people have sponsors. But as far as like really doing trauma work in a 12-step sort of traditional addiction model, it doesn't happen that often. It just doesn't happen that often. So the key is to have like these safe environments where people can do this work. And that's what Rythmia is about. And so let's get your long-term trauma resolved. Let's just like handle it in a week. Just come down here and let's just do this, because you're sick of being influenced by this subconscious stuff that's not relevant anymore. The bottom line is you're not 5. You're not being under, you're not under attack, and you're not trying to hide in the closet anymore. Now you're an assertive, probably very successful person who just doesn't feel connected to the people you're around all the time, and you're kind of confused as to why. Well, I know why. This is part of why. Come down here. Let's fix this thing, get you guys handled. Pura vida. Thanks for watching. See you next Monday.